Good evening, San Diego City Council and fellow residents. I want to thank you for the time to talk to you about heart disease and to present a prevention program that will make a difference in our community. Why is heart disease prevention important to me? Why is it important to all of us? I'd like to share my story with you. My sister Sharon came to visit me 4 years ago from Manassas, Virginia. We grew up in Paradise Hills. It had been a while since she had last visited San Diego. When she was here, we enjoyed the time we had together. We took the bus and trolley all over San Diego, like tourists rediscovering our hometown. We were able to fit in time to go to a Padre game. The game was the San Diego Padres versus the Los Angeles Dodgers. Unfortunately, the Padres lost, but we had a great time. We were making happy memories. When she left San Diego, I did not know that it would be the last time that I would see her. I did not know that I was going to lose her suddenly from a stroke. Were there signs? Yes. Did we have history of heart disease in our family? Yes. Could I have done anything to change what had happened? I will never know. I may not have been able to stop the stroke from happening to her, but today I'm driven to make a difference to honor her memory and for all those affected by heart disease, past and present. This brings me here in front of you to propose the program, The Heart Truth, a prevention program. For our South Bay communities in San Diego, this is important. The Heart Truth is sponsored by the National Heart, Lung, and Blood Institute with the partnership of NHLBI, local community organizations, and health programs. I would like to start a program in our local neighborhood. The Heart Truth is focused on the heart health of women. Here are a few facts about heart disease. According to the Center for Disease Control and Prevention, heart disease is the number 1 cause of death for women in America. Heart disease and stroke cost the United States an estimated $316.6 billion in healthcare costs and loss in productivity in work in 2011. Of course, these numbers have actually increased. Heart disease involves several conditions of the heart. The most common condition is coronary artery disease. Undetected or untreated coronary heart disease may result in a heart attack or stroke. Risk factors for heart disease include high blood pressure, hypertension, high cholesterol, diabetes, excessive alcohol use, and obesity. 1 in 3 women have high blood pressure in the United States. According to the health status report taken by the Health and Human Services Association of San Diego County, the southern region residents have the highest rates of coronary heart disease and hospitalizations from stroke. Our neighboring city, Chula Vista, had the highest amounts of death related to CHD and stroke. Within our diverse community, heart disease affects our Hispanic, Asian, African American, Pacific Islanders communities equally. The primary focus is to serve all communities. The objectives of the Heart Truth program are to bring awareness that heart disease is the leading cause of death among women, decrease the risk factors of heart disease, increase awareness that having risk factors can lead to heart disease, disability, and death, and identify who likely would be to develop heart disease. We also like to promote action within women to promote heart disease and control. And also, we'd like to start a conversation within women to start preventing heart disease. By creating an environment supporting the prevention of heart disease and setting an example of good health, we can change the lives of those in our community. I am here to ask for the support of the city to partner with NHLBI, local health organizations, and the community to provide supplemental funding for the prevention program, The Heart Truth. I'm asking for $8 million to go towards supporting education programs that will work towards making better choices for weight control, weight reduction, cessation of programs for smoking and alcohol use, and to promote exercise by creating walking clubs and co-ed sports leagues. The programs implemented would reduce the visits to the hospital, medications, and loss of work. With the Heart Truth program, the hope is that we can reduce the statistical numbers of casualties and deaths caused by heart disease. Having a healthy, happy community is well worth having. I'm sure that you or someone you love, someone you know, a friend, a neighbor, has been affected by heart disease. I'm asking for all of us to take on preventing heart disease and to take a look at the Heart Truth.